On January 11, 2020, Chinese state media reported the first known death caused by a novel coronavirus, COVID-19. On that same day, New York City hit a record daily high temperature, previously set in 1975. It was winter, but you couldn't tell by the scene in Central Park. It was abuzz with picnicking couples, bicycle-drawn carriages, horse-mounted officers, and runners passing by. Just a typical day in the city. On March 11th, the World Health Organization declared COVID-19 a pandemic. The US declared a national emergency 2 days later. By mid-May, it is estimated that more than 24,000 people had died from the virus in New York City, which became one of the hardest hit areas in the world. The COVID-19 pandemic has been the deadliest event in the history of New York City. City hospitals mobilized their resources to meet unprecedented challenges. Pop-up hospitals opened in many parts of the city, including Central Park. Regardless of specialties, doctors were recruited to help care for patients, while practicing doctors and nurses worked around the clock. Japanese and Japanese American doctors, nurses, and medical staff were among them.
During my first week in COVID ICU, I had a 36-year-old patient who was doing okay and suddenly spiked fever to 109 and passed away in 2 hours despite our best effort. I vividly remember standing next to his bed, feeling very helpless. All the patients were fighting in the hospital alone without their family members at bedside. When they were awake or when they were able to speak, we tried to do FaceTime as much as possible, thinking that could be the last time that they could talk to each other ever. Despite these challenges, all healthcare providers and hospital staff worked extremely hard, and I think we showed a very strong bond and teamwork. We also appreciated all the support and the kindness that we received from the community during this difficult time.
Dr. Colvin is one of the many doctors who are members of JMSA, the Japanese Medical Society of America, which is part of the Japanese Medical Service Network, or JAMSNET. This network was founded in 2006 and now counts 27 Japanese organizations among its members. During the pandemic, each organization of JAMSNET extended its support to the community based on their expertise and capacity. This vital support was in areas such as mental health, domestic violence, childhood education, and health insurance. Among other activities, JAMSNET organizations help to provide useful information to people with disabilities, pregnant women, and public assistance recipients, and even held origami workshops as therapeutic group activities. As the pandemic raged, 2 organizations initiated bento projects. JAA, the Japanese American Association of New York, delivered free bento boxes to elderly Japanese and Japanese Americans who are isolated and homebound during this time. The Nippon Club, the only Japanese social club in the US, delivered bento boxes to medical personnel working on the front lines of the fight against COVID-19. These projects could only succeed because of the community, which gladly came together to support this mission, and included the generous contributions and kind support of Japanese companies, individual donors, hundreds of volunteers, and different entities such as JCCI, the Japanese Chamber of Commerce and Industry of New York.
週に2回260個やっております。私としてはやはりその料理人なので医療従事者の方にお弁当届けたいっていう気持ちはあったんですけれども、やはりこういうたくさんの方のサポートがあったりとか、このプロジェクトを続けることによって日本クラブのメンバーシップの日本クラブが皆さんに浸透していくように、こういうニューヨークの地域社会貢献を目指してやっていきたいと思っております。
やっぱりこういった美味しい日本食をですね、皆さんにお昼に食べていただいて、元気になっていただいて患者さんをテイクケアしていただくとやっぱりいうことは大事だなということと、日本の企業の連合体がですね、こういったことで地域の医療に貢献すると少しでもですね、それは大事なことなんじゃないかと。
So we all wanted to assist the most vulnerable in our community, our seniors. At a time when they had to self-isolate, food was scarce, and Japanese food, a great source of comfort for our community, was a challenge. Under these circumstances, we started a small committee in April under the nonprofit umbrella of the Japanese American Association. Just as much as the seniors enjoyed the wonderful taste of Japanese food and Ito and tea, the volunteers, callers, and those who delivered look forward to checking in with their assigned seniors to make sure that they were in good emotional and physical health. They provided our seniors and themselves with much needed social interaction.
Through this bento project, I was reminded that I don't volunteer so that I could make myself feel good about myself. I volunteer so that I could make other people feel happy. I try to help those who need the help, and I think that's the true reason why people volunteer. Thank you for this experience.
Since last May, the Nippon Club has overseen the delivery of more than 6,000 bento boxes to medical workers, while the Japanese American Association of New York has delivered more than 2,500 bento boxes to seniors in the community. The COVID-19 pandemic has affected every element of life in the city, including public safety. The 24th Precinct is located on the Upper West Side of Manhattan, a residential and commercial community that encompasses the Manhattan Valley and part of Riverside Park. Deputy Inspector Naoki Yaguchi is the commanding officer in this area, the first Japanese American to achieve the rank of captain in the New York Police Department.
So for the cops, it was a really difficult time. The concern for them obviously is that they're dealing with so many people out in the public, and they're bringing that home back to their families. And I know that was a real stress for them. I really commend the cops for working through that. We had about a third of our command, about 40 people test positive initially during the first wave. We've had a couple more at a slower pace in the past couple of months. But it's been a challenge for them, and I really commend our cops and cops throughout the city for working through that. So initially, right when the pandemic hit, actually things slowed down. We were taking less complaint reports, crime definitely dipped, but as we entered the summer months, violence in our precinct and throughout the city spiked considerably. In 2020, we took a total of 9 shootings. The prior year, we only had 1. In addition to that, we had 27 firearm-related incidents throughout the year, which was a significant number. So we definitely did see an uptick in the summer.
If this pandemic has proven anything, it is that no one knows what the future holds. Yet it's equally clear that together we can weather any storm. It is in this spirit that we would like to express our deepest and most sincere gratitude to those in our community, the healthcare and frontline workers, and to all the Americans who battled COVID-19 in many remarkable ways. Rain doesn't last forever, and brighter days are in sight. Together, we will overcome.